Greetings from Philadelphia. I'm Dr. Rachel Tate from West Palm Beach, Florida, and I am here representing Team PsA to give you the best of PsA from ACR 2022 for today, which is Saturday, November 12th of 2022. So I'm going to give you two abstracts today. The first is abstract number 387, entitled Sleep Quality in Patients with Psoriatic Arthritis and its Relationship with Activity and Comorbidity. So this was by Dr. Martinez et al. It's a cross-sectional study, nearly 250 psoriatic arthritis patients, and the group looked at multiple measures. But one that they included, which is really interesting, is a PSQI questionnaire regarding sleep. So ultimately, their analysis showed that 4 out of 6 psoriatic arthritis patients self-report poor sleep quality. This was mainly found in our female patients, but it was also associated with increased enthesitis, increased disease activity reporting, in addition to fatigue, anxiety, and depression. Now, I don't think that's necessarily what's so interesting about this subject. Here's what's really interesting about this actual study. Only half of these patients, again, self-reported poor sleep quality, were on medications in an effort to improve their sleep. We didn't have any discussion regarding non-pharmacological interventions for these patients, but we all know that sleep is very important. It's also quite complex. So while this study doesn't share the whole kind of paradigm of sleep regarding our patients, what it does point out for me and for our team is that we need more data regarding sleep independent of disease, but we also need to be discussing and integrating sleep options for our patients in clinical practice and working that into our clinical repertoire, whether that be pharmacological or non-pharmacological interventions for patients. So just kind of keep that as a clinical pearl in the back of your mind. Our next abstract is number 377, entitled Differences in Early Onset versus Late Onset Psoriatic Arthritis. Now, this is data from the RESPONDIA and the REGISPONSER studies. This was by Dr. Puche-Larrubia et al. And the objective of this particular study was to understand disease differences as they may be related to early, age less than 40, versus late onset, age greater than 60, for our psoriatic arthritis patients. Now, as I mentioned before, this is actually an observational study looking at RESPONDIA and the REGISPONSER registries out of Spain. Again, nearly 250 patients. What they ultimately found was that the late onset patients, so again, those over age 60, predominantly were male. They had higher structural damage at baseline from their disease. They had elevated VAS-Phs, and of course, they had more upper extremity arthritis. That's interesting, but what they also found was that those patients were less likely to have sacroiliitis and enthesitis. So kind of showing a different spectrum of disease than we had maybe thought previously. So also interestingly, early versus late disease onset had no effect on the overall quality of a patient's life, the disease activity itself, or changes with treatment options. So this is the first day of ACR 2022, and this is our day one report for Team PsA. We're absolutely looking forward to tomorrow. We're going to have more PsA specific abstracts. And as always, for more ACR 2022 coverage, log into roomnow.com.